Now, made in Rochester, Gorbel is a local company that makes big cranes for industry. Well, they've discovered how to use the same ideas on a smaller scale to help people walk again. Natasha Alford tells us about Safe Gait.
When Mark Landers was told he'd never walk again, he looked for a way to beat the odds. Then he was asked to test out a new medical technology called Safe Gait, and suddenly the impossible was within his reach. Mark Landers left the hospital 3 months after the day that would change his life forever.
They say I was rubbing my chest and rubbing my leg, and I didn't know. They thought I was having a heart attack because I was in perfect health.
It was a tear in his heart valve, an aortic dissection. All of his right leg and part of his hip had to be amputated. He was told he'd never walk again.
The nerves had died. They just didn't think it was a possibility.
Or so they thought.
So scoot forward in the chair a little bit. You ready? Got yourself?
I'm good. Mentally, your brain needs to tell you to take that first step in order to walk again.
But the body needs a boost, and Mark is getting it from a new technology created right in our backyard. It's called Safe Gait. Mark was one of the first to use it here at Nazareth College.
Using this system, we were able to do things we never did before, like get rid of both crutches, barely holding onto my hands.
Safe Gait is a ceiling-mounted racetrack which attaches to a body harness to hold Mark up. It lets him move 360 degrees, and therapists can adjust the level of support.
And I didn't have to worry about crushing the PT or falling and hurting myself and going back into the hospital.
But this breakthrough didn't come from a medical research lab. It came from Gorbel Inc., a local company that makes overhead cranes. After a Gorbel employee's daughter suffered a brain injury, she went to the company's CEO with an idea. The same technology they make to lift heavy equipment could be used to lift people in therapy.
It so aligns with what we can do from a technology standpoint, but it even better aligns with improving people's lives.
And it has for Mark.
To come as far as he's come is nothing short of a miracle.
Now his eyes are on the next big goal.
This is exciting, and we could have you stand up, we could walk out.
A first dance at his daughter's August wedding, and maybe even one more miracle.
My goal is to be able to walk down the aisle, walk her down the aisle and hand her to her new husband.
Anything's possible. Safe Gait has been tested at Nazareth College, Monroe Community Hospital, University of Rochester Medical Center, and other local hospitals. It makes its national debut next week. Natasha Alford, News 8.